this is picking up where I left off from the last video. Tachypnea can also fall into the category causing this, and is defined as the condition of rapid breathing, 20 or more breaths per minute. Hyperapnea is an increased depth of breathing when required to meet the metabolic demands of our body's tissues. So in other words, when the body lacks oxygen, we breathe deeper to make up for it. When we breathe too slowly, we can cause hypoventilation to occur, and this is a reduced rate or depth of breathing that doesn't meet our body's requirements, and this is usually 12 breaths per minute or lower. Due to our body's carbon dioxide concentration can increase, and this is also called hypercapnia, and this results in respiratory acidosis. Hypoventilation can be caused by medical conditions, holding your breath for too long, from drugs, usually depressants, and overdose. Those who do hyperventilate are at risk for becoming hypoxic if it goes on for too long. There can be dire consequences if their person's lung chamber becomes damaged. Examples of lung chamber damage are chest wall contusions or hematomas, rib fractures, flail chest, sternal fractures, pulmonary contusions, pulmonary lacerations, pneumothorax, hemothorax, hemopneumothorax, tracheobronchial tears, pericardial tamponade, myocardial contusion, and traumatic arrest, just to name a few. For this activity, I chose a flail chest to describe the pathophysiological disease or process or problem for. Flail chest is when 3 or more ribs are fractured at 2 or more places each, and this creates a freely moving segment of chest wall that moves paradoxally to the rest of the chest. Signs and symptoms of flail chest are paradoxical chest movement, bruising, grazes, discoloration in the chest area, chest pain, difficulty drawing breath or labored breaths, shortness of breath, and cardiac abnormalities. To treat a flail chest in a pre-hospital setting, a lot of concerns is patient comfort, as well as monitoring any vital changes. Treatments include applying high-flow oxygen, cardiac monitoring, pain control, usually through IV medications, placing them in a position of comfort, and applying a bulky dressing. The bulky dressing keeps the segments from moving in an opposite direction and rubbing up against the surrounding muscle and bone. This also lessens damage to the surrounding tissue and overall just creates stability. So this has been my lung activity, and thanks for watching.